Good evening. I am ready to start whenever it is. I think if two more people will join, then we can start the session. Shall we start the session?
Yes, sir.
Okay. So, like, I asked for somebody to volunteer for the active candidate. So, is the active candidate already selected, or I shall select from the three people who have joined?
So this will be the interactive session for all.
No, I specifically told that it cannot be interactive session for all the candidates. It will be like one person I shall select then who will be discussing the case with me at the end of the session. Like it will be
Yes,
10
sir.
minutes
You
only.
can do that.
The other two people can ask the questions if they want to. Okay. So I shall be discuss. So hello, I'm Dr. Sangshaptak Saha. So today's session is the first class on communications. Communications in the new format is like it will be two cases, station 1 and station 4. So today we shall be mostly doing the station 2 cases. One will be, so there are three candidates. So I shall be selecting one person who will be doing the case actively with me, and the other two persons can ask me some questions at the end of the that part. And after that, there will be another second case where another candidate will be doing, and the other two people can ask me the question after that. So I shall share my screen, and I think Dr. Rejoy Bandyopadhyay, he will be the first candidate for active candidate for the first case. Is that okay, Dr. Rejoy?
Yes, sir.
Yeah, fine. So you will be doing the case actively, and I shall once I share the screen, you will have 5 minutes to read the case. After that, you shall I mean, it will be like an mock exam only. So you shall be doing it 10 minutes. Just allow me to share the screen. I think my screen is visible.
Yes, sir.
Yeah. So 5 minutes.
So everyone has joined.
Uh, Dr. Rejoy, your 5 minutes are up. I think we can begin the session. Dr. Rejoy? Hello, can you hear me? Dr. Rejoy, can you hear me?
Yeah, good evening, Dr. Sangshaptak sir.
Good evening.
Yeah, on of the side, sir. Actually, Dr. Vijay Bandyopadhyay is probably in the traveling, so that's why you can't join in this meeting. So you can go with the others candidate. There is a Dr. Shobik Pandey is there.
Okay,
Dr.
so
Tina.
whoever you can, I think everybody has seen the screen. So whoever can do the session can just unmute themselves and tell me,
Yeah.
and I start the session.
Yeah. Dr. Shobik Panja sir and Dr. Tanmoy, if you want to join this session, so please unmute your mic and please join this session.
Dr. Shovik, if you are available, then unmute yourself and we shall do the session. Because in the communication session, it needs to be one person who will interact with me directly. Otherwise, communication session cannot be taught. I mean, I can teach it. I can do the role play and everything. Dr. Tanmay, I showed the scenario for 5 minutes, but yeah, you can see it again. In the exam, you will get 5 minutes. They will not allow you a second more. Once you are ready, you can unmute and tell me.
Yes, sir. Dr. Tanmoy is wrote something in chat box. Can you please show the scenario? Okay, I think the doctor is interacted with you.
Sir, I'm ready.
Okay, so we shall start. Doctor, like you know how the scenarios go usually, right? You have practiced.
Yes, sir.
Yeah, fine, excellent. So you can just start. Okay, you have
Okay,
entered the room and you can start. Yeah.
Okay, sir. Um, Good evening. I'm Dr. Tanmayi. I'm the doctor in the clinic today. Are you
Good evening.
Mrs. Ann Bath, the 43-year-old?
Yeah, I am.
Yeah, it's nice to meet you. I'm here to discuss about your health condition. Is it okay with you?
Yeah, it's fine.
Do you have any idea about your health issues?
Yes, doctor. Actually, I am having some pain in my tummy for the
Yes.
last. It previously also it was there, but the last few weeks or like last month, it has been a bit more than usual.
Okay. Is that it? Is there anything else you want to add? Are you taking any medication for that?
I am taking some medications. I also have passed a loose stool for a few times. So I am taking some over-the-counter medicines for that. Besides, I'm having this problem for a few times previously also. So I
Okay.
know which medicines to take. So I have taken those medicines, but I have not got much of a relief this time.
Okay. So I'll explain your condition. So you are suffering from something called celiac disease. So which means your intestines, your small intestines, are not able to digest gluten properly. Gluten is a substance, a protein which is found in mostly wheat. So whenever you're having wheat or any substances which contain wheat, for example, bread and pasta, you will develop something called soreness of your intestine. So these substances react badly and cause all these symptoms. For example, you will be having tummy pain, you will be having diarrhea and abdominal discomfort. Are you getting me?
Uh, uh, Doctor, what you were telling is that I have some disease and
Yeah.
all my features are because of that.
Yes,
And
it is called
because of
celiac
something
disease.
and it's because of something I'm eating, right?
Yes.
Okay. So, like, what is the disease about?
So your defense system is reacting abnormally to the your food in the digestive tract, in the small intestine. So whenever you are eating this gluten containing foods, for example, bread and pasta, you are developing these symptoms. So along with that, you are also having anemia and low blood levels, which can be corrected easily with iron and folic acid supplementation.
Yeah,
But
so I'm already taking.
yeah, okay, I understand that, and that's a good decision on your part. But you also need to do something called gluten-free diet.
What is gluten, doctor?
Gluten is a protein contained in wheat. So there are many foods which are available, for example, rice, barley, which you can eat, and these are completely fine. They won't react with your intestine, they won't cause any abdominal, any tummy pain or diarrhea. So this is one of the most preferred modality for your condition. Are you
Okay.
getting it?
Yeah.
So if you can adopt this
like
diet, that will cause like relief of your symptoms.
Okay, doctor. Like I love taking this wheat, this bread. It's a part of my diet. I mean, I in the breakfast I take some of those. I take some crackers, and in the night I usually take bread. So you're
I
telling me that
understand.
I need to avoid those?
Yes, I understand it very difficult for you, but if you can do this, unfortunately, this is the only treatment available.
So is it only the so I only need to avoid this bread, like this rotis,
Yes.
and everything else I can eat.
Yeah, you also need to avoid some barley and rye containing foods also.
I don't eat barley or rye anyway.
Okay, that's good. You can eat rice, you can eat oats to some extent. So I would suggest you to go for these foods. And
Okay.
all fruits, vegetables you can eat. You can eat meat. You can eat eggs. I'm sure you can, if you try, you will be able to manage with these foods.
Okay, doctor. Okay. So, doctor, I'm already taking these pills. You are telling something about iron, that I have
Yes.
less iron in the body. So I'm already taking that.
Yes.
And I saw, and I went to a GP last week. He told that my iron levels are improving.
Okay. So if you have completed 3 months of this iron tablets, we will check the hemoglobin again in your blood.
Yeah,
If that
because
is normal,
I have, yeah, okay.
if that is normal, we can safely stop these tablets. Are you having
Okay.
any other problems?
Actually, you see, after taking this iron, etc., though I'm maybe because my blood levels have gone up, so I'm feeling much better.
Okay, that's good to
So,
hear.
do I still need to modify my diet?
Yes, you still need to modify your diet because the only treatment available is gluten-free diet, unfortunately, and that works very well in your condition.
Okay, so I can take
We can
rice.
provide you a dietitian referral. We can provide you a nursing care so that they will help you with your diet. They can make a diet plan and help you with the nutrition level.
Why do I need a nursing care, doctor?
Dietitian, sorry.
Dietitian. Okay. So this because you see my one of my cousins, she has
Yes.
this disease strange name celiac disease, I have told her, and she eats some food products which she tells that it's she cannot tolerate that food product itself, and she tells that the loose stool was better than this gluten-free diet that you were telling. So
Okay.
will I be able to tolerate it? Because I love eating food. There are people who love eating food and enjoy their meals. I am one of them. So
Yes.
yeah, how will it go ahead?
Yes, I know it's difficult, but first you have to try, and you'll only see the improvement in symptoms. And maybe you will start liking a few foods also, which you can try new, which you have never tried before.
Like rice, right?
Excuse me?
Like rice.
Yeah, yes.
Okay. Okay. How sure are you that this disease is what you are talking about? And I mean, it can be simple case of like some bugs in my gut which is causing this diarrhea also, right? These loose stools.
Yes, but you have been evaluated thoroughly, and you have also been they have also conducted an endoscopy test, which they pass a tube inside your stomach and take a small bit of a tissue, which was taken from your intestine. So that tissue was examined in the lab, and it showed strong evidence of celiac disease.
Yeah, they did a pipe test, camera test, which
Yes.
yeah, okay.
So
Okay.
this diagnosis, we have good confirmation, and we think this is right. There is no doubt about it.
Okay. So I only need to stop eating the this wheat containing food, this
Yes.
gluten, and
Yes.
which is only present in the wheat and some other food product like rye and barley, which
Rye and barley.
don't eat. And I need to take rice, right?
Yes, exactly.
And I need to go and see a dietitian.
Yes. Do you have any other concerns?
No, doctor, I'm okay.
Okay.
You have 3 minutes left. When in an exam, whenever you have 3 minutes left in communications, you have to realize that you are missing something. Otherwise, there will be
Yeah.
no time left.
Yeah. Um, I can ask about smoking and driving, but right now it's not relevant.
What else?
Occupation.
Occupation is already mentioned. She is a librarian.
Yeah. Is it affecting her job in any way?
She needs to go to the washroom multiple times. That's it. Otherwise, it's okay.
So that will improve on changing the diet.
Yeah. So if you ask that and if you tell her that, then it will be more easier for you to convince her about the taking the diet. Okay.
Yeah.
So that is one point. Second point is you did not ask about alcohol.
Okay.
She is a beer lover. She takes
Okay.
beer, 2 pints of beer every day. Beer
Okay.
contains gluten.
Huh.
And if you had asked and if you had told that she can't take beer, she would have become extremely anxious and told that it is not possible for her. That was the main point of the scenario.
Okay.
Do not forget asking about the. I mean, I'm not telling that was the main point. I'm just telling it so that you remember. Okay, that would have consumed at least 1.5 minutes of your time.
Huh.
She's a 43-year-old librarian. If you would have told that, yes, I end the library at 6 p.m., then I go and. Hello, sorry for the interruption. Till when did you guys hear me? Can you just tell? I shall restart from there.
Yes, sir, we can hear you.
Yeah, I know. I mean, till which part did you listen previously? I can restart from there.
Like nothing, sir, actually.
Pardon?
We couldn't hear anything after my discussion.
Okay, fine.
You just told me not to like leave 3 minutes extra, and then you talked about the beer. That's all.
Okay. Yeah. So after the beer part, so what I am telling was that, yeah, then I was analyzing you. So first was introduction. Your introduction was okay. Like it was fine. You introduced yourself, you asked me my name and my age, and you confirmed the patient identity and you started. That was fine. Then you asked me why I am here, like what are my symptoms. I told you something, you told me something, and that was also okay. But after that, you directly told that you have celiac disease. So do not do that. You need to give a warning sign. You must have practiced the breaking bad news scenarios. So
Okay.
yeah, so not the whole breaking bad news, but just parts of it. Like here, I have marked here that they have mentioned that an upper GI endoscopy appeared normal. Small bowel biopsy shows subtotal villus atrophy, consistent with diagnosis celiac disease. So utilize this information. You can tell that what I read from your charts was that a camera test was done and some biopsies were taken and the biopsy reports have come, and now we know what is the cause of these symptoms. And then I would have asked that what is it, doctor, or you could have asked do you want or you could have just paused for 2 seconds, told that it's something called celiac disease. Again, a 2-second pause, and then, do you know what it is? Always after telling the disease, ask them whether they already know what it is. Then what happens is that I would have told, because in the explanation I already told you that one of my cousins have this, so I already know the name of the disease. I would have told you that yes, my cousin has it and it's a very bad disease. There is a diet chart involved. My cousin only can take a few food and which is pretty unpalatable, and the taste is not good. And I would have given you these things, and immediately you would have got the idea that once I tell you about the diet and dietitian, I shall refuse, and then you can mentally start preparing that what your defense will be. Okay, so yeah, the warning shot, 2 seconds gap, then the diagnosis, and then how you reach the diagnosis if it's mentioned obviously. Otherwise you cannot. Here they have already mentioned in exam also, even a similar scenario they will mention how they reach the diagnosis. After that, you went to the explanation directly. So yeah, as I told, ask whether they know about the disease, and if they tell that yes, this has happened, my cousin is in bad shape and because of food, and then always tell, I'm sorry that your cousin is suffering, but here I can assure you that whatever you do, it will be keeping your interest in mind, and then you will immediately get some marks about the patient welfare. So that is one part. These are very easy marks. Then after that, you are not pausing. After 3-4 lines, you ask me whether I'm getting it or not. Initially, I prefer that once after every 2-3 lines, I usually asked when I was preparing, sir, like, are you getting it, or ma'am, are you getting me? Do you need me to explain anything else again? Like that. So a bit better flow, like nothing specific, but a better flow would have been welcome. Then another point was that autoimmune disease, because what is your task? Your task is to summarize the nature of the gluten enteropathy. So your task was to mention about the autoimmune disease. Now you explained about the autoimmune disease, that the body itself is fighting against the body's own tissues, and that's why it will get happening. And this is called autoimmune disease, which is a medical term which you do not need to know to avoid the jargon use. And second is gluten. Never use the term gluten. Gluten is definitely a jargon. You can use it is a protein, because I asked what is gluten. In the exam, the surrogate asks you what it is, immediately you will know that you will lose some marks for using jargon. Similarly, the word intestine, small intestine, use gut, small gut for these purposes. Okay. Anemia,
Okay.
use low hemoglobin. Anemia is actually a borderline term. Anemia may not be considered jargon, but if I was you, I would have used low hemoglobin. Then celiac disease is one of the most commonly asked scenarios in the exam. So you need to have a better idea about which foods contain gluten. Apart from these whatever you mentioned, this beer, alcohol, then few nuts, processed meats, some soups, soybean, pasta, these all contain gluten. Okay, and beer, then potato, pasta, soy, nuts, all of these you have to manage. These are common food products. You need to tell that you need to avoid them, and you can tell 2 times, 3 times that why you need to avoid. If the surrogate is not not agreeing, then you can tell that. Then you need to realize it's a fine boundary. You can't tell that once I have told and then the surrogate refuses, and you can't refer the patient to a senior or to a dietitian. Try 2 times at least, better 3 times. Then you can tell that I'm sorry, that I am unable to explain it to properly. But this needs to be done. I can refer you to a senior, or I can refer you to a dietitian. I'm not all and a dietitian. So preferably after 3 attempts, you can tell that. But once the patient, because if you tell the patient only instead of the rotis, you can tell the rice, then everybody will be okay, very much okay with it. But if you tell all of these diet products and to an alcohol intake person, you tell no alcohol, then they will refuse. Then they will tell you that no, it's not possible. Try something else. Or I am okay with the iron and folic acid supplements. I do not need to alter my diet. That is what the communication session is about. Because if the surrogate is agreeing everything with you, believe me, you need to find out some points which you will not agree with. Because This session is about making the surrogate agree with your plan. He will not agree with everything. So if he's agreeing with everything, you are missing something. That is, that is the truth. So always be aware of that. Okay.
Okay, sir.
Yeah. And I have got something else, I think, prepared. Just a minute. Yeah. So this is basically a few points. So first is listening to the patient. You asked me this point you covered symptoms, what she actually anxious about. This I would have told if you ask me what job I do and about my alcohol intake. And what does she need to know? She needs to know whether she can continue as a librarian. You did not ask my concern, right? What am I concerned about? I would have told you this job is interfering with, I am the sole librarian. It's a neighborhood library. I do not do a big job. It's a neighborhood library, but I love my job very much. And I am the sole librarian there. I need to go to the washroom now 8 times a day, 6 times during my duty hours. So the library is considering firing me. That's what I'm worried about. It's nothing to do with the diet. It's to do with the job. Never ever forget what is occupation in any PACES station, not only in station 1 or station 4, also in your long clinical cases, right? Never forget this. And never forget the alcohol history, driving history, smoking history, and your illicit drugs, if applicable. Illicit drugs, if applicable, do not ask about illicit drugs here. But smoking, why did not you remember smoking? Why did not ask about it? Smoking increases celiac disease signs and symptoms.
Yes.
Yes, so you need to ask about it. Make a routine about smoking, alcohol, and driving in every case.
Okay, sir.
Yeah. Because it does not contain negative marks, right? Even if you ask about driving, maybe we'll waste 10 seconds about it. Not more than that. But you definitely need to ask about smoking, alcohol, occupation, and what are your concerns. Don't leave the session without asking this, because that is a separate, solving the concerns is a separate clinical skill, which will be asked not in all of your sessions. In your clinical session, that is speak, CNS, CVS, those will not be asked, right?
Yes, sir.
Yeah. And here they have removed the consultation with, the interaction with the teacher, with the examiner. So the examiner will not be able to help you out.
Yes,
It
sir.
all depends upon how you are interacting with the surrogate. Then this was about what the patient will tell you. Here is what you shall tell to the patient about the disease, about the problem mentioned other than the disease. Like here about the alcohol problem. Here like about the work issue. Changes recommended, you told you need to improve on that. As I told, treatment was okay about the foods, but you need to increase your knowledge about the gluten containing food, how the disease may affect her, because because here is not asked, but the concern may be is it cancer. You need to tell it is not cancer directly, right? It can never be associated to cancer. How the lifestyle changes may affect her. This also you need to tell that even if you do not take alcohol, or if you even if you decrease the alcohol, even if you decrease the smoking, you will immediately see that some good effects are happening. Maybe that will help you to stop smoking altogether. Maybe that will help you to not take alcohol altogether. And obviously, will be referred to this past history, family history, if applicable. Here, family history definitely applicable. Comorbidity, surgery, driving, occupation, smoker, alcohol intake, illicit drugs. They are not allowed you to take the history, but since it's an autoimmune disease, you can ask whether she suffers from any other disease or not, because autoimmune disease often comes in pairs, especially hypothyroidism, those type of things. So you can ask even if you miss, unless it's obviously present in a scenario, your marks will not be cut for that. Pregnancy, family history, depending upon the case. This, any help needed at home, you always need to ask about this. Counseling, dietitian, you mentioned. Food programs, you need to refer to celiac food programs. There are separate food programs available. So dietitian, celiac food programs, counseling regarding the alcohol here. Any help needed at home, whether she needs an occupational therapist, that you can allow. So these are the parts I think where you need more help, apart from the explain the disease or those part of things. Because I think you are missing these parts. and this part carry separate. Okay. So Dr. Tanmay, I think you did well. Obviously, you need to improve. Have you already got a seat for the exam? Or like
Yes, sir. December.
so you still have some time.
Yes, sir.
Yeah, do practice. It's like when I used to practice, I did not. I mean, I used to practice in a hostel, so I did not have any partner to practice with. So I used to practice on my own only. I just saw the scenario and then I used to like think about what are the expected question, and I would answer them, and I would see which points am I missing. You need to get a common set of things we need to cover in the communication sessions. Past history, family history, alcohol, driving, smoking, occupation history, what's your concerns, any programs, dietitians referral, any help, social, occupational. Okay. So these things you cannot miss. These are common in most of the sessions. And there are, I think, 50 odd scenarios for communications. You need to be well practiced in all of them because communications is easy marks. Communication is possibly the easiest session of them all. So, I mean, of the sessions of PACES, MRCP PACES, don't lose marks here.
Okay, sir.
You will definitely improve. I think you will definitely improve. I think it's still a significant time left. 3 months are left. So practice more. Okay. Okay. So somebody else should volunteer for the next case. There's second case also. I shall just show you the case, and after that, somebody can volunteer. Yeah. So this is the case. 5 minutes read the case. After that, 10 minutes we shall discuss with one candidate, and after that again 8 to 10 minutes we shall discuss about the case itself. Okay, I think 5 minutes are up. So like who will be the active candidate? Just unmute yourself and you shall start the session. Anybody who is like available and not traveling can just do it. It's a practice session. So like no extra pressure or anything. It's a small group also. Usually the other PACES classes that I take are around 20-25 candidates. So here it's a small group. So I think it's a much more relaxed environment. Yeah, Dr. Tommy, of course you can do it again if others are not interested. So let's start, okay?
Okay, sir.
Yeah.
So, hello, I'm the doctor in the clinic today. Good evening.
Good
Is
evening.
it so your father Harold Wilson is admitted with us. You are his daughter, right?
Yes, doctor, I am the doctor.
So he's a 89-year-old gentleman, and I understand that he has already a stroke and is a diabetic, right?
Yes.
So, can you tell me what you wanted to know?
Doctor, I want to know why is my father not in the intensive care unit?
Let me explain you what happened till now. Your father has been extremely fragile because of the stroke and diabetes, and also due to age. And right now, he was admitted with something called congestive cardiac failure, which means his heart is not pumping effectively. We have instituted all necessary treatment, all the pills and injections which are indicated for him. But despite all that, his heart condition is not improving. In fact, he's worsening, which means his other organs, for example, his brain and kidney, is also getting affected. That's why he's a bit drowsy and he has not passed any urine since around 4 hours.
Oh,
Are you able to understand?
yes, I know all this. That's why I want my father in the intensive care unit, because clearly he is not suitable for ward management.
You have to understand that your father and your brother have made a decision not to put him in the ICU because they feel it may cause more suffering than any
My
benefit.
father was involved in the decision.
I'm sorry, your brother was involved in the decision.
Okay.
So at that point of time, only he was available and we had to consider his decision.
Okay, so now I am available, so you can consider my decision also, right?
But unfortunately, even if we shift the patient to ICU, we may not achieve anything, any improvement in his condition.
So like my father is not improving here also, so he will not improve in the ICU also. But the ICU is for this type of patients only, right? Who has got different organs are failing and he's not improving on the ward. So like, what is the rationale behind not shifting my father there? I know I know that my father is old and he has got a stroke and now he's very sick. That's why I want my father in the ICU.
Yes, I understand. But even if we shift, he may not improve. And in fact, if we shift to ICU and put him on other medications or other breathing machine, in fact, he may develop more problems than benefits.
What problems can he develop? He's already, I think he's going to die here. So anything more
Yeah,
problem?
there may be tubes and pipes we have to insert in his body, which may be causing pain and discomfort. And may need to connect a breathing machine. So all this at this point of time may not help him much. And in fact, your father will be more suffering because of all this. If there is a point that we are sure that despite doing all this, he will improve, then we would have definitely tried. So your
So
brother
how
did not
sure are
want.
you that he will not improve in the ICU with these machines and these pipes?
We are sure because he's 89 years old and he's already developed a stroke. He is almost housebound since that time, and his diabetic is also very bad, in very bad condition. So all this, considering all this, we have to tell you unfortunately that the scope for improvement is very, very narrow.
But it's still there, right? Narrow is not zero.
Yeah, but but you need to also understand that what your father might suffer because of this.
Oh my. Okay. So like if he's not shifted to the ICU, then
Yes,
your management here is not improving him, right? But from what I
yes.
understand. So like what is your next plan?
So we unfortunately will try with the same medication, but
Not infuse anything. He's not improving on the medications. I can understand that.
yeah. So unfortunately, he may not improve also, and he may pass away. But I like one of you or
May I die?
can be with your father and be with him.
Yeah, Dr. Katika,
We
don't
can
tell
provide all
pass
help.
away like this in the exam, okay?
Okay.
Anyway, continue. I shall do it
We
later.
can provide you social support and you can call any religious leader from your to help with you.
Okay. So what
I know
else
it is
can
an
I do for the patient, for him?
uh, uh, right now there's not much we can do. So we will provide medications for to make him more comfortable. For example, if he's experiencing any pain or discomfort, we will give good painkillers. And if he's having lot of secretions, we can give medicines to control that. Are you getting me?
So like somebody told that he will not be resuscitated in event of cardiac arrest. So what does that mean?
If we do resuscitation, again, the outcomes may not be very good. So that's why we have taken that decision that we won't resuscitate him. In fact, we may cause more problems. Like I said, we may cause any rib fractures if we do a lot of chest compressions, which again may be painful for your father.
Okay. So doctor, like I understand that and I accept that why you're not shifting him to the ICU. But till that happens, the cardiac arrest, and when the cardiac arrest happens, you will not be doing anything either.
Yes.
So like from now till the cardiac arrest happens, what are you like? Why is like he's in a hospital, right? So something must be.
Yes. We will provide whatever is going on till now, and we will provide all the comfort care necessary for him.
Okay.
We will give him small feeding. We will manage his fluid in the lungs, and we will provide
How-
some amount of oxygen.
How will you manage the fluid in the lungs?
I will give medication like diuretics, which means they will remove the fluid in the lungs and through urine.
Okay.
That his breathing may be better.
Okay. Okay.
Do you have any other doubts?
Yeah. My main doubt was that why is he not responding to the treatment?
So one of the reasons that he's not responding is probably, again, I'm sorry to say, maybe his age, and he may be having underlying cardiac issues,
Okay.
which have been like just discovered. So even if we want to do anything, again, it will cause a lot of pain for him. That's why we are not doing.
Okay. So like he has been here for the last 5 days.
Yes.
Okay. So the like anybody else has any has any senior doctor seen him?
Yes, we have taken this decision as a team. There have been other doctors who have been visiting him and have been informed about his condition.
Okay. And like I want to speak to them.
Yes, definitely I can refer you to the other consultants involved. Is there anything else you want to know?
No, doctor. So the main thing is here is to pacify the patient's relatives, because this daughter who has come, she does not stay with the patient, right? The patient was with the son,
Yes.
and she has come after 5 days. On day 5 of the admission, she has come, so she probably does not know what has been happening. So
Okay.
the main part among in the 10 minutes, the first minute you are explaining who you are and like who the daughter is and those things. So be very careful here, because the daughter's name is not mentioned. So you have to ask whether you are a daughter of Mr. Harold Wilson, who is 89 years old.
Okay.
And like in this scenario, from the surrogate will be a bit angry from the first minute only. So you will be expecting that. Then from the second minute to the around to the 6th minute, you need to explain about the medical condition.
Okay.
Like not at a stretch, obviously,
Mhm.
but you will be asked how will you go. Like you'll be asking, "Hello, I'm the doctor. I'm the doctor working here, the general medical ward. Are you the daughter of Mr. Harold Wilson, who is 89 years old?" Or you can ask our daughter of Mr. Harold Wilson. And once I tell yes, then you can tell it, and your father is 89 years old, right? Then you can tell yes. Then I can tell yes. Then you can tell that, ma'am, ma'am, we have met here today to have a discussion about your father's about the father's medical condition. How much do you know about your father's health? From there, then the daughter will tell that I do not know much. I do not live with him. I do know that he's old. I mean, obviously, I know that he's old, and he has maybe she knows about a stroke. You'll tell that she has a stroke this much as ago. She's on some regular medicines. I'm not sure which ones are those. Maybe she will tell that she has been hospitalized in the past also. Then you will get your defense points that she knows that she's old. He's old. She knows that he's a diabetic on medicines. Or even if not diabetic, he can mention that she's on multiple medicines. If she tells that I do not know anything, that can also be a scenario. Then you will tell that I am sorry to tell you this, but your father has been admitted with us for the last 4 days, and he came here with some features of a disease called a congestive cardiac failure, which basically means that the heart is not pumping very well. For that, our senior doctors have seen the patient, and we have provided him with some oxygen. We have provided him some medications, which will help with his medical conditions. With these medicines will increase the urine output from his body. Despite that, his urine output has been decreasing, and he has not passed urine for the last 4 hours. And despite us providing oxygen, his oxygen level in the body is still quite low. Are you getting me till this point? I am so sorry. I know that this is a lot of information to share, but I am trying to give you as much information as possible. Is it okay if I move forward? She may become angry. She may tell you that why was I not informed about all this previously? She may tell that okay, with this what improvement is there, or over the last 4 days, what I know that despite you guys doing everything, he is not responding. You need to respond to that. You need to give me the time. When I was listening, you are continuously telling what you are wanted to tell. You need to give in these grievance scenarios, or in this scenario, need to tell the surrogate that, ma'am, please tell what you want to say, not directly or indirectly. Because what the surrogate tells, you can respond to that. If the surrogate is very angry, you can tell her, ma'am, I know that you are very upset. I shall give you some more information. Or you can, if the surrogate may start to cry, may be emotional, then always apply some, then offer some tissues, offer some water. Ma'am, do you need a second? The surrogate always tell, no, please continue because it's an exam. They will never take a minute. So you need to give them that opportunity, and so that you can respond, so that the examiner knows that yes, this person is good in communications. Anyway, so after you give this information in the next 4 minutes, so now you are in the 6th minute. So from 7th to 9th minute, or the next minute, 9th minute, you need to tell that despite this, then obviously during the 2nd to 6th minute, if you give the surrogate appropriate time, he will ask you the question, why is my father not yet in the ICU? Then you mention that this is the points, he's very sick, but during because of his age and his medical conditions, we feel that shifting him in the ICU and giving him the intensive care will only delay the inevitable. This decision has been taken by the consultant, right? Reviewed by the consultant. Always involve the consultant if it's already mentioned in the exam paper. And gently, don't tell that he will be dying. Never do that in the exam. This is also a case of DNR, which has been taken by the consultant, by the doctor team, and the same has been agreed with the patient relative, who is the patient's son. So that is a good enough next of kin. So it's a final decision. There will be no change of that, right? We know that. So you need to give the information to the daughter gently that this is the medical condition, these are his comorbidities, this is the decision that has been taken. He will not be shifted to the ICU. Try to tell it in the first 5 to 6 minutes. Then solve that issue in the next 1 minute. Then give the decision that even in the event of cardiac arrest, which is a likely outcome here, he will not be resuscitated. And why? And the surrogate will be like furious that you are not improving my father, you are not shifting the ICU, you are not resuscitating him either. So why the hell is he in the hospital? That will be the usual reaction of any common person. So then you tell that yes, rib fracture, intubation difficulty, aspiration, chance of infection, futility of care. Even after all this, he is still furious, not trying to understand, you can refer to the consultant who's already taken the decision, right? You can tell about the team effort, the team decision, and the consultant, multidisciplinary team care, and we can arrange for a meeting as soon as possible. You will not be arranging for the meeting. You will be referring to the concerned section for them to arrange the meeting, right?
Okay, sir.
Yeah. So it's a tricky scenario. I mean, not a tricky, it's a very common, it's one of the more common scenarios, but you need to be very, very sympathetic, empathetic, and use all your soft skills in this scenario. Okay.
Okay.
Because the DNR decision already been taken. DNI decision already been taken. And it has been taken with the patient's son. And here the daughter has come who does not know that much, and you need to give the whole 5 days summary along with the DNR decision, everything in the 10 minutes. You need to be obviously to give the whole information, but it should not be appear that you are hurrying. And you need to give the appropriate, sympathetic support to the daughter also. It's a lot to be done in this scenario. And you need to be very, very, very well practiced for these scenarios. Otherwise, it will be a mess in the exam.
Yes, sir.
Yeah.
Sir, what if she tells, why am I not consulted? Why are you taking only brothers?
Yeah. If she'll ask you that, then you can tell that it is a consultant decision, but from what I know, these decisions can be taken by the doctor, providing the general consensus of the patient, and the decision needs to be given to the son. Because look, legally, the daughter or the son cannot ask for the patient to be shifted to the ICU. They cannot ask for any medical treatment. They cannot ask for the dialysis. They can ask for the intubation. They can refuse the intubation. They can refuse the dialysis. They can refuse the ICU. Okay. What treatment will be given, that is the sole decision of the treating team. Nobody else can ask for that. They can only refuse the decision. I mean, refuse the treatment. The DNR decision, it can be taken by the relatives also, provided that there is an appropriate custody, legal custody, or it has been taken by the patient himself beforehand when he was in full sound state of mind and health. Okay.
Okay.
Right now, the DNR decision can only be taken in this scenario, can only be taken by the medical team. The son or the daughter need not be involved in it at all, but you cannot tell that to the son or the daughter. You need to tell it appropriately. You are getting me what I'm telling, right?
Yes, sir.
Yeah. And he has a lot of comorbidity, 9 years old, stroke 5 years ago, bed bound. So quality of life is already low. Tell about quality of life. They are very, very concerned about the quality of life. And he's already diabetic on insulin. And he has not improved over 5 days. So it's not an acute case. If it was like a 5 hours before, then you can tell that let's see what turns up. I mean, you do not still know. Maybe he will improve. But a person who with this coma not improved over 4 days, you know that he will not improve. And always involve the consultant here. Always do that.
Okay, sir.
Yeah. Tell that I am arranging for a meeting with the consultant. Will you like that? If the surrogate may tell no, I do not want, I am okay with you, then that's okay. But from your point of view, always tell that. And ask, and you mentioned about the priest and not the priest only, I mean the
Religious element.
yeah. Also tell that about any social help, or like if you are done with the scenario beforehand, you can tell that do you need any help right now? I mean, whoever come with, do you need any help? Like those are soft skills which you can do. But in this scenario, in 10 minutes, you will not be able to finish anywhere. So these points you need to make beforehand, the 5 minutes you are getting. So 5 minutes is not only for reading, but it's also for making the points that we will need to cover within the hall, I mean in the exam room. Is this your first attempt?
Yes, sir.
Then you have no idea what a pressure cooker situation it is within the exam hall. Believe
Yes,
me,
sir.
you will not get that feeling before you enter the room. It's a practical thing. Look, if somebody tells you that it's not a high pressure situation, then they are simply lying. It's a extremely high pressure situation. Are you from India?
Yes, sir.
Yeah. So like I have done my MD, DNB, DM and DRNB. I have also given my completed my MRCP and EDIC. MRCP PACES communication skills is a single most high pressure situation I have faced in all of these exams combined. So yeah, so don't take it lightly. If you are well prepared, then it's okay. And the preparation is in those 5 minutes. If you're missing some points during those 5 minutes, get inside the room. You will not be able to think to miss the points that you want to cover beforehand in those 5 minutes. Okay. Then you will be fine. Otherwise, it's very difficult to to modify yourself in the room in front of the examiner and the surrogate, because there will be two examiners. They will not be speaking, but they will be there.
Okay, sir.
Yeah. So the this class will be taken every Friday. I think next session will be some other faculty. Then again, after that I shall be taking. So it will be 2 sessions from, I mean, on those Fridays which I shall be taking, there will be 2 sessions, and I shall be trying to cover diverse situations as far as possible. And like one person should volunteer for the active participation. Otherwise, in communications, if it's not an active participation, then it's very difficult for me to do both the things. So if one person is ready to do active participation, then after that I shall discuss, and if anybody else has any other questions, then I shall solve those doubts also. It's not an issue, but it's very difficult to do, like to solve it on my own. And it will also give you the not only the active participant, but from my experience on the passive participants also is very helpful, because the passive participant should also be writing down the point that I was talking about, that they should be knowing that which points they would have covered if they were the active participant, and then they can see which points they missed or which points they covered, which maybe during the discussion was not discussed. That is the way to do this, because active participation for every situation is not possible everybody. But in this way, the passive participants can also get the benefit, and we shall definitely rotate between the candidates.
Sir, here in the situation, it's not mentioned about do not resuscitate.
Right. A minute.
Sir?
It's mentioned. Let me just tell you. Manage conservatively and not resuscitated in the event of cardiac arrest.
Okay.
Yeah. So every point is important. See, from the first point itself, you are a junior doctor, so you need to introduce it like this. You are working as an evening cover on a general medical ward. So if the patient asks you something which is not mentioned in the scenario, you do not make it up. You simply tell that I am the junior. It will be asked in the end only. You can tell that I am the junior doctor working here. I shall consult with my consultant or my senior. I can tell you that, or I can arrange for a meeting with my seniors. You can tell that. This is why this information has been given. Then the age has been given. He had a stroke 5 years ago, diabetic on insulin. He lives at home with his son, but has been housebound since his stroke. So quality of life is low. And you have to mention this once while you are discussing. Okay. So this is the part that's given. He was admitted 5 days ago, so he has not improved over 5 days. So again, as I told, he will not improve further. So you have already tried everything for the last 4 days. After that, you have come to the treating team has come to a decision. And obviously, the surrogate will ask you what therapy. Then you can use this oxygen pills to increase the urine, to decrease the fluid in the lungs, and drugs which will help him with the heart failure. Don't use these terms because these are pitfalls. Don't use the term vasodilators. Don't use the term diuretics. Okay.
Yes.
And clear cut, they mentioned there has been no responsible treatment over the last 5 days. Currently, just give me a minute. He's short of breath and is hypoxia despite the oxygen. Not pass urine for 4 hours. GCS is 8. Right?
Yeah.
So current situation is bad. He has not improved. He is proceeding towards the cardiac arrest, and you need to convey that message to the surrogate. First, you need to give this information, then this information, then this information, and then this information. So 4 information you need to give. After this, I think you missed this. The do not resuscitate option is already there. So don't do these things. Okay. Don't
Yes, sir.
miss the information given. Not resuscitate event of cardiac arrest. And it's a consultant decision. And his son is already has already been conveyed the decision. Right? Right. And now this is the person who you are talking with, that information. It's also been mentioned here. Be very careful with whom you are talking with. And this is her main concern. Why is my father not in the ICU? So if you cover these 5 points clearly, then this concern will be solved. If you are not doing this, then this concern will not be solved. And towards the end, as you rightly asked, do you want to ask me anything else? And he asks you, I want to see the consultant or I want to see the senior. Then it's fair enough. You can simply tell that yes, I shall arrange a meeting as soon as possible, and I shall refer you to the department who will refer you to the staff who will help you with that. Right? Hello.
Yes, sir. Understood.
Yeah. So, Dr. Tanmay, so what are the? In the 10 minutes, there is no like surrogate faculty interaction, but here there are a lot of points, the legal and the ethical aspect that needs to be covered. So, what do you think are the legal? Because they will not be asking you this, so you need to cover them while you are speaking. So, what are the legal aspects here?
Autonomy.
Legal aspect, doctor. Autonomy, non-malfeasance, beneficence, and those are ethical aspects. Okay, sorry, this is from the previous scenario. Yeah. So as we discussed, this DNI, where is it here? This DNI, DNR, no escalation of care. These are all legal aspects. Okay. And here the decision has been taken by the consultant, by the doctor, by medical team, because it has not been mentioned whether the patient had a legal treaty or something like that for not escalation of care or something like that. So all these are legal aspects. And what to mention about autonomy and non-malfeasance and beneficence and equity of care, those are ethical aspects. Equality of care, here the surrogate may ask you, we are not rich, is that why you are not shifting my patient to the ICU? Then you can tell that no, it's not the case. These are the factors. We treat everybody like the same. So you can do that. Non-malfeasance is definitely not intubating the patient, not putting the patient on dialysis. Those are non-malfeasance. You are not doing something which will not actually improve the patient. Beneficence is all these therapies that we are giving, all of those are beneficence. Oxygen, diuretics, fluids, vasodilators, all of these are beneficence. Okay. And autonomy here, I think the patient does not have autonomy, at least right now, because the GCS is 8. Okay, so you need to cover these points. This is not previously, this used to be asked by the examiner that what are the ethical issues, what are legal aspects here. But here you need to be very sure. So in those 5 minutes that you will be getting beforehand, you need to read the scenario. You need to mark out 4, 5, 6, maximum 5, 6 important highlights of the scenario, which you need to cover during the 10 minutes. And you also need to mark out the legal and ethical aspects. Okay. So if I may just, yeah. So suppose this is the piece of paper that has been given to you. So just divide the paper into 4 parts. In the first part, if you are not confident, you can simply write whom you are speaking with on one line, and then you write down 4 or 5 points which you think are important for the scenario. Here you write the legal aspects. Here you write the ethical aspects. And here, like in this scenario, this smoking, drinking, driving, these things are no longer significant, obviously. So you can erase these points and the work or the occupation that they're doing in the social help, occupational help, any dietitian. If you can provide some leaflets or PDF or the websites. So this is an important part, especially in the previously this celiac disease question. This part was very important, right? As we discussed, their ethical or legal aspects was not that important. So it will vary from scenario to scenario. But if you make this chart and then you can see which scenario you are dealing with, and that will make your life much more easier, and you will be missing less points. Similarly, the passive candidates can also make this scenario when they are using the 5 minutes, and that will help you with the case, and it will improve your presentation and also your time management. Because if you get this 5 points, then you will be knowing that I need to spend maybe 6 to 7 minutes of my time on this and 2 to 3 minutes of my time regarding this, and never forget what are your concerns. At least 1 minute for this, because this is a separate skill which you need to pass, and this will be present only in these scenarios and your long cases, not in your clinical cases. So you cannot cannot get the marks from there. Sorry. This is the first class. You can always contact the Farz Academy and tell me how I did, or whether you want something else, some specific scenario that you want to discuss, because there are 50 odd scenarios on communications. It won't be possible for me to discuss all of them, but if there are specific scenarios which you find difficult, then you can do it and join, and then you can do it, and I shall do those scenarios. And in some specific improvement that you suggest, you can suggest that, and I shall try to do that. Okay, that's it for today. If others do not have any question, and I can end the session. And please be ready to participate actively. I don't think there are any questions. It's the first session, so everybody is quiet. I hope it will be more active session from the next classes. Thank you. Good night.